So a second ago, you talked about cognitive Aaron Beck's cognitive therapy, and I hear a lot of controversy around CBT. In my grad program, it was said a number of times that if you're a heterosexual white man, cognitive behavioral therapy can be an effective treatment, but it is inappropriate to use for women and racial minorities, and it's often a form of gaslighting. What do you think of these type of claims?
Well, I think that's terribly destructive, and it's a question to be answered empirically. Let's take, for example, obsessive compulsive disorder. In the 70s and early 80s, a lot of work showed that it was highly effective at helping people overcome compulsive rituals and obsessional thoughts. But most of the studies were done with white people, as you say. Well, how science deals with that is they replicate studies with more diverse populations. They test it out with Black clients. They test it out with women. They test it out with gay men and lesbians. And lo and behold, exposure therapy and response prevention works just as well with them as it does with white heterosexual males. And all these studies done in North America, you know, you take it to India, you get the same effect. It's a wonderfully effective treatment, and it works all over the world.
How can you explain the bias against CBT in our field?
It's very threatening when people advocate for treatments that really do work because it does violence to their pre-existing thoughts and feelings about what they're doing. They know it really works well. And to hear somebody like Aaron Beck come along and talk to somebody who's doing insight-oriented psychotherapy, says, no, 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 I have a technique that's much better. And when you do head comparisons to some of these behavioral methods, and cognitive behavioral methods and exposure methods with insight-oriented psychotherapy or supportive psychotherapy. The more activist treatments come out ahead almost all the time.
Mm.
And
How do you define activist treatment?
we're actually doing things. I mean, if a
Oh,
client's depressed and they don't have a job and they're broke, as a social worker, I'm going to do my best to try and help them find work. And I can't do that only sitting in the office. I need to help them track down resources. I need to engage in job interview skills for them. I need to help teach them how to do phone interviews, to reach out, to write letters of application, to use the internet and things like that, and keep going at that till they get a job. Then once they get a job that they enjoy, their income goes up a bit, and then some of that stress in life that was making them depressed begins to alleviate over time.